Hello everyone, I Dr. Arashdeep Kaur from CTU University Ludhiana and the department is Pharmaceutical Sciences. Today I deliver a lecture on Alzheimer disease. Okay, in Alzheimer disease, first we study about the introduction, then the pathophysiology of Alzheimer disease, next is sign and symptoms, their diagnosis and their treatment. Now we study about Alzheimer disease. Alzheimer is a neurodegenerative disease. Neurodegenerative means neuro means neurons and degenerative means loss. If there is a loss of a neuron inside the brain, the person having a symptom of Alzheimer disease. And the first most common cause of Alzheimer disease is a dementia. Dementia is not a progressive disease, it is a set of symptoms like the person having a symptoms of memory loss and the judgment impairment. If the person having any two type of symptoms, the person is diagnosed with the Alzheimer disease, and it is a start in a early late stage or in a middle old age. So in a result there is a memory loss, impairment in a thinking and change in the personality of a person because of a loss of a neurons, because there is a no connectivity from one neuron to another neurons. If there is a no connectivity from one neurons to another neuron, there is a no chemical messenger inside the neurons, there is a impairment of a chemical messenger. If the chemical messenger is lost, that means the person having a loss of neurons and eventually the brain cell will die. If the brain cell die, the person having a brain shrinkage. So brain shrinkage is the most common symptom that arise in a Alzheimer disease patient. Like the normal size of a brain, and in Alzheimer disease the person brain become a shrinkage. If the person brain become a shrinkage, that means the person's brain cell will die. So there is a no connectivity, there is a no body functioning properly. Okay, so that's why the person having a symptom of a brain, like their memory loss, impairment in a thinking, impairment in a judgment and a personality loss. Next we study about the etiology. Like in etiology, 6.5 million of people in a United States having a age 65 or older than 65 is suffering from a Alzheimer disease. Like 70 to 75% of the peoples with the age group of 75-year-old is suffering from a symptom that is known as a dementia, and 55 million of peoples worldwide is suffering from a dementia, and 60 to 70% is estimated to have a Alzheimer disease. So the early sign of the disease is include forgetting recent events and the conversation. Over a time it is a progress, and after the progression that leads to a serious memory loss, and the serious memory loss and the loss of ability to perform a everyday task. For like the person having a loss in their memory, loss in a memory and loss in their daily functioning, the person having a problem in a everyday life because of a loss of neurons. Next we study about a pathophysiology. Before studying about a pathophysiology, you have to know about that the Alzheimer is basically caused because of the deposition of a protein, the protein that is present inside the brain. Next is a causes of Alzheimer disease is completely understood by a two major players that is present inside and outside. In its progression is plaques and tangles. Okay, so in a brain there is a presence of a small protein that is a myeloid precursor protein. The myeloid precursor protein is present inside the brain. There is a presence of a cell membrane. The one end of a myeloid protein is present outside the brain and another end is present out inside the brain. So APP is a myeloid precursor protein which is helpful in a neuron growth, their repair, their regeneration and get used, broken down and then again repair. So APP have a two enzymes like alpha secretase and a gamma secretase. These enzymes break the proteins into a two segments, and these enzymes helpful to soluble that protein into the cytoplasms. Okay, remember there is a presence of a two enzymes, alpha secretase and gamma secretase. These are the two enzymes that is present in a APP protein which is helpful in the solubilization of that protein into the cytoplasm. So if there is a entry of another enzymes, like if there is a entry of a third person, like that is a beta enzyme. If there is a entry of a beta enzyme in their normal cycle, that beta enzyme is team up with the gamma secretase enzymes and that will cause up problems. like because beta secretase enzyme is a insoluble, okay, that insolubilize the protein. If the protein is insoluble in the cytoplasm, that means there is a deposition of a protein, because in a normal phenomena the alpha and gamma secretase is only the enzymes that is helpful for the solubilization of a protein, solubilization of a APP proteins inside the cytoplasm. But if there is a attachment of a beta secretase enzyme in with the gamma secretase enzyme, that is a insoluble and which will cause a problem. So the main cause of Alzheimer is a deposition of a protein. So the beta secretase enzyme is team up with the gamma secretase and cause a problem. And this fragment is insoluble and create a monomer. That monomer is known as a amyloid beta. Okay, so the monomer, that monomer is a chemically sticky and bound together just outside the neuron and form a beta amyloid plaques, because beta secretase enzyme is a insoluble. Okay, if there is a insoluble, there is a deposition of a sticky substance that is known as a monomer. Monomer is a chemical sticky substance that is present outside the neurons. If that is deposit outside the neurons, that is known as a beta amyloid plaque, and that plaque is disrupt the signaling from one neuron to another neurons, and that will cause a memory impairment. So the plaque activate the immune response, like something is entering, the third person is entering in the normal phenomena, that means there is a activation of another response. Same in this system, if the alpha and gamma secretase phenomena, there is attachment of another enzymes, that is a beta secretase enzymes, and that beta secretase enzyme deposit outside the neuron, that will cause a problems. After the deposition of a plaque, there is a activation of a immune response. So if the one time immune response activate, that will cause a inflammation. If the inflammation occur, which may damage the surrounding neurons, and the amyloid plaques are deposit around the blood vessels in the brain and caused a amyloid angiopathy. Angiopathy is a term that is used like in a blood disorders, okay, like a blood vessels disorder. There is a hemorrhage of our blood vessels, so which weaken the walls of our blood vessels, and when the blood vessels weak, that will increase the risk of a hemorrhage, rupture or a blood loss. That is a one major phenomena that is to understand the pathophysiology of a Alzheimer disease. The next phenomena is a tangles, like after the deposition of a plaque, okay, after the deposition of a plaque, there is a rupture of a blood vessels. When the blood vessel rupture, that protein is enter inside the neurons. In a plaques, there is a phenomena of outside the neurons, but in tangle, what happen inside the neurons? So inside the neurons, the tangle is found inside the neurons, because the beta amyloid protein that build up now from outside to the inside of the neurons and initiate the pathways inside the neurons. Then there is a activation of a kinase, and that kinase transfer the phosphate group into the tau protein. So the tau protein changes the normal shape of the neurons, and which will causing a microtubules to collapse and clumps up with the other tau proteins. So the tangles is known as a neurofibrillary tangles, that is a non-functioning cause a apoptosis. As a neuron die changes take place in the brain, that will cause a brain atrophy and a brain shrinkage. If the brain shrinkage occur, eventually the cell will die. If the cell will die, the person having a symptom of Alzheimer disease, and the person is diagnosed with the Alzheimer disease. So that is the pathophysiology of Alzheimer disease, how it occur in a person. The first major phenomena is a plaques, and the second phenomena is a tangles. After the formation of a plaques, that enter inside the neurons and that form a tangles. Again, when the tangles form, there is a no functioning inside the neurons, there is a no communication between one neuron to another neuron. Then the person having a brain shrinkage. When the brain shrinkage occur, the person having a symptom of Alzheimer disease, like there is a loss of a memory, loss of a judgment, loss of a personality. Next, there is a diagrammatically show in a slide, there is a healthy brain with a healthy neuron, but in Alzheimer disease patient, the structure of a brain become a shrink, there is a formation of a plaques, formation of a tangles. So because of that, the person having a disease of neurons. If the person having a disease of neuron, that means the person having a loss of neurons. If the loss of neurons, the person having a Alzheimer disease. So these are the structurally shown in a diagram, that is a healthy brain and in a Alzheimer patient brain. Next is a symptoms. Now we study about the symptom of Alzheimer disease. Okay, the first symptom of Alzheimer disease is a confusion with the time or place. The person didn't know about the exact time and a place. Maybe within some times he or she will forget what the time is and what the place where they occur. Next is a trouble following in conversation, like the person immediately forget what the conversation is going on between the two persons. Next is a memory loss, trouble in familiar task, like if the person having Alzheimer disease symptoms, the person having a problem in a daily activities. Okay, like the persons didn't memorize the exact didn't memorize the exact objectives. Next is a misplacing the things. The person, if the person is having Alzheimer disease, the person misplace the things, like in a diagram that shown the person put a phone into the water glass. Next is a changes in a mood or personality. Suddenly the person mood become changed, like person suddenly the person in a sad mood, in a happy mood, or in a anger. Next is a explanation of this symptom. First is a memory loss. In a memory, like everyone has a memory lapse at a times, but the memory loss associated with Alzheimer disease persists and maybe it get worsens. So over the time the memory loss affect the ability to function at a work, at home. So the people with Alzheimer disease maybe have a repeat statements and question over and over, because the person having a loss of memory, so they maybe repeat the statements and question over and over again. Next is a forget conversation, appointments, or events. Next, misplace the items, like often putting them in a place that doesn't make a sense. Next is a get lost in a place they used to know well. Eventually forget the names of family members and everyday objects. Having a trouble finding the right words for objects, expressing thoughts, or taking part in a conversation. Next is a thinking and a reasoning. The Alzheimer disease causes difficulty in a concentration and in a thinking, especially about abstract concepts such as a numbers. The person forget the numbers. Eventually the person with Alzheimer disease may be unable to recognize and deal with the number. So next, the symptom is making judgments and decision. If the person is suffering from a Alzheimer disease, they having a less ability to make a sensible decision or a judgments in every situation. For example, the person may not know how to handle food burning on a stove or a decision when driving. So in Alzheimer disease patient, the doctor advised to avoid driving because the person didn't remember the exact place or the exact time or the exact things in a car. Next is a changes in a personality and a behavior. Brain changes occur in Alzheimer disease, so it affect the moods and behavior also. So the problems may include is like depression, loss of interest in activities, social withdrawal, mood swings, disrupt in others, anger or aggressions, changes in sleeping habits, wandering, loss of inhibitions, and delusions. These are the symptoms that is experienced by a Alzheimer disease patient. Next is a diagnosis. In diagnosis, how to diagnose Alzheimer disease? First, to diagnose Alzheimer disease, there is a physical examination and a neurological examinations. A healthcare provider will perform a physical exam, like which include reflexes, check the reflexes of a person's, that the reflexes is a normal or a abnormal. Next is a muscle tone and strength, ability to get up from a chair and walk across the room, like doctor tell the patient please walk and please sit on a chair, and check the reflexes of a patient. They properly sit on a chair, maybe they is not properly sit on a chair, they didn't find the chair. Okay, so these type of symptoms that is experienced by a patient for a diagnosis purpose. Next is a sense of sight and hearing, coordination or a balance. The next is a magnetic resonance imaging, that is known as a MRI. MRI is another diagnostic test to diagnose Alzheimer disease. So in a MRI uses radio waves and a strong magnetic field to produce detailed image of the brain. While they may show shrinkage of some brain regions associated with the Alzheimer disease. So we already know in Alzheimer disease there is a brain shrinkage. So in a MRI the image show there is a shrinkage of a brain. If the shrinkage of a brain occur in a MRI, that means the person having a symptom of a Alzheimer disease, and maybe he or she will be diagnosed diagnosed with that. So in a MRI also rules out the another conditions which is generally preferred to a CT scan to evaluate dementia. So the next is a CT scan, that is a computerized tomography. It is a specialized X-ray technology which produce cross-sectional image of your brain. It usually rule out the tumors, strokes and a head injury. Maybe the person is suffering from an Alzheimer disease because of some accident, because in an accident maybe the person having a head injury, and because of that head injury maybe the person's brain cell will die and that will cell cause a brain shrinkage, and the brain shrinkage is again the causes of Alzheimer disease. So these are the symptoms, these are the diagnostic purpose to diagnose a Alzheimer disease patient. So CT scan which visualize the image to produce the image of a brain, maybe the person having a stroke problem, maybe the person having a tumors, maybe the person having a head injury, because of that he or she is suffering from a Alzheimer disease. Next is a positron emission therapy, PET. PET means which capture the image of a disease process. So during the PET scan there is a low level radioactive tracers is injected into the blood to reveal the particular feature of a brain. There is a injection that is injected into the brain to recognize the exact image inside the brain. So first is which include a fluorodeoxyglucose PET imaging, that is known as FDG PET imaging, which shows the area of a brain in which the nutrients are poorly metabolized, and finding patterns in the area of low metabolized can help distinguish between the Alzheimer disease or another type of a dementia. So next is a amyloid PET imaging that measure the burden of a amyloid deposit inside the brain. So this test is mainly used by researchers but may be used if a person has a usually or very early onset of a dementia symptoms. Next is a tau PET imaging. In tau PET imaging which measures the tangles inside the brains and which is used in a research setting. So positron emission therapy is a good diagnostic to diagnose Alzheimer disease. Like in a positron emission therapy there is an injection inside the brain to recognize the proper functioning of a brain. Like first is a nutrients, if there is a less availability of a nutrients maybe the person having a symptom of a brain. Next is a amyloid. Like amyloid there is also a causes of a protein. So amyloid, in amyloid imaging there is a check the amyloid protein, the presence of amyloid protein. Next is a tau protein. Again tau is also a causes of Alzheimer. So check the presence of a tau protein inside the neurons. Next is a treatment. In treatment there is a no cure of a Alzheimer disease. So the primary goal of therapy is improving the symptomatic decline by improving cognitive functions, daily activities and behaviors. Like if the person having a symptom of a brain related to their brain and related to their body, so guide the patient, cope up with patient, okay, like there is a family sitting is necessary for that patient because there is a loss of a memory, okay, because in that stage the person lost their name of their family members. If the person lost the name of their family members, maybe the person having a stress also, maybe due to the stress the person having that problem. So advise the patient to sit with their family members, to sit with their friends, okay, to recover with their disease. So first to improve the symptomatic relief, like if the person having a memory loss, if the person having a judgmental impairment, if the person having a personality loss, so first improve the symptoms, then decline the cognitive functions like the emotion of a person, okay, like their mood, sad, happy or a anger mood. So first then decline that mood. Next is a daily activities, like if the person having a problem in a daily activities, so advise the patient to perform it in a proper way, okay, advise the patient, guide the patient, you put a wrong thing in a wrong place, so don't do that, okay. So these type of things, that is only with the help of a family members, only with the help of a friends the person may be cope up with their disease. So in a drugs that is used in Alzheimer disease patient is a cholinesterase inhibitor. Cholinesterase inhibitor is a class that is used in Alzheimer disease patient, which include a donepezil. Donepezil is a drug which is with the 5 mg dose and that is given in a per oral. PO means per oral and OD is a once in a day for 4 to 6 weeks. So given a donepezil 5 mg 4 to 6 week in an Alzheimer disease patient, and the dose increase up to 10 mg, means first start with the 5 mg per oral once in a day for 4 to 6 weeks, then increase a dose if the person having no changes in their symptoms. So that dose is a 10 mg. So if the symptom is a more severe, that is not cured with the 10 mg, then the dose will be increased up to a 23 mg. Okay, so not more than 23 mg dose is given to a Alzheimer disease patient, maybe that will cause another effects, because every drug having a side effect or a adverse effect. So the normal according to guidelines, not given more than 23 mg to the Alzheimer disease patient. Next is a NMDA agonist. So that will include a memantine. Memantine is a drug that is a 5 mg per oral. PO means per oral once in a day, and which increase the dose up to 10 mg. Like in a donepezil, there is also increase of a dose, like first start with the 5 mg, then increase the dose up to 10 mg, not more than 10 mg, and it is for 4 weeks. So the Alzheimer disease patient is treated with these type of drugs, and there is no another treatment for that drug for the cure of a Alzheimer disease. Now that is done. Thank you, and if you have any question and answers, you can ask.